Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Happy Aloha Friday. Thanks so much for tuning in here on this October 22nd. I'm Ryan Kalei Suji, joined by Yanji Denise, and this is Spotlight Hawaii on the platforms of the Honolulu Star-Advertiser. Yanji, this morning we head over to the Department of Health to get an update on COVID-19 and its impact on our community.
That's right. We're joined now by the Department of Health Director, Dr. Libby Char. Dr. Char, thank you so much for being here this morning.
Good morning. Thank you.
So we just saw those numbers come out around 9 o'clock, 134 new cases today, 3 deaths, unfortunately. But it does feel like the numbers are starting to hold pretty steady right now. How are they looking to you?
I think we're in a good place overall right now. We saw a 8-week spike, and then we've come down for several weeks now. And so I think we're heading back towards our baseline. I think we're in a good place. We've been very deliberate about making sure that we, are very reasonable and sit tight with the measures on reopening until we come to a good place. What we've seen in some other states is that they plateaued at a relatively high number of cases, and so they're continuing to have a lot of trouble for their hospital systems and their healthcare workers. So we deliberately are trying to make sure we come down to a good baseline.
A lot of news coming out this week about the vaccine and the boosters that will be made available. What can you tell us about when that will begin rolling out, what people can expect, and how they may be going about getting the additional booster shot if they so choose to get that?
So we just had a CDC call this morning, and as of yesterday, the CDC okayed booster shots. We're trying initially to get the booster shots to those who are 65 and older, and then also to those who are 18 and older who are at high risk for severe COVID, and to those 18 and older who have frequent occupational or institutional exposure. And so that's the initial target group, and it's pretty much the same for Moderna and Pfizer and Johnson & Johnson. So good news on that front that those all got okayed. We're anxious to get the community out to especially for the long-term care facilities and those who are in congregate living. And so we're starting to roll out the plans. We've been working on the plans for quite some time, and we're trying to get it rolling now. I think we should be in a good place.
I want to bring in this question from Tony. It was one that occurred to me when you were answering about where we are right now. He says, what is the baseline? What is a level of infection that we should feel comfortable with as a community?
Well, I think if you look at the epi curve on the Department of Health website, you can see that back in June and July, we were in a place I think it's unrealistic to think that any place would have no cases. And I think COVID's probably here to stay in our community to some degree, but we want it to be a level where we can manage it ourselves. And it's not causing undue hardship on healthcare or anybody else. I think if we brought it down less than 100 cases a day and we consistently stayed there, I think that's an okay place. We weigh that with knowing, though, that we don't want anybody to get sick from COVID. And especially now where we know that up to 30% of the people who get COVID are still going to have symptoms at 6 months. That's huge. And we, again, don't know the long-term effects of COVID. And it's not negligible. So we don't want anybody to get COVID, but I think we as a society, right, it's always a risk benefit and trying to do our best, but at the same time, allowing things in our society to go on. So I think if we came down, just look at the epi curve, but I think if we were under 100 cases a day, I think we could probably manage that as a community quite well.
Another question coming in from Heidi asking about the opinion on boosting, on J&J boosting with Moderna and Pfizer. We know that there are information and there has been just talks about that mixing of the vaccines and using another for a booster shot. What can you tell us about this question that Heidi has?
Yeah, there's been some interesting science. Again, I'll preface it by saying that this is still early in the pandemic when it comes to things like the booster shots and the mixing and matching. But what we're seeing is that the mRNA vaccines are actually very, very similar. And so if you got Pfizer for your first shot and you get Moderna for your booster, that should be fine. And likewise, if you did it the other way, that should be fine. The Johnson & Johnson is interesting because what the studies are showing is that for those who got Johnson & Johnson, if they get a booster with a different shot, it seems to boost the antibodies to a higher level than if they get a booster with Johnson & Johnson. That being said, I don't think just looking at antibody numbers is the be-all end-all. What we still don't know is, perhaps boosting with Johnson & Johnson will give you longer lasting immunity. We don't know about the T-cell immunity as well. So it's interesting to see, but at least at this point, all of the boosters seem to be safe. All of them seem to confer some advantage in raising antibody levels. And so the recommendation is that people who are in those categories, 65 and older, 18 and older who are at high risk, and 18 and older who have frequent institutional or occupational exposure, go get your booster shot. The other important piece of that is that for Johnson & Johnson, it's if you got your initial shot 2 months ago, go get your booster. And for Pfizer and Moderna, it's 6 months ago.
This feels a lot like when the vaccine was first rolled out and we made certain groups high priority. Eventually, does it seem that we'll all have access to the booster if we want it, or is this something that will be, you think, reserved for the long term, just for those categories?
Well, I think we're waiting to get more data from larger studies. My guess, if I had to guess, would be that eventually boosters will probably be available for everybody.
Another question, of course, is coming out about the vaccine being available for children. What can you tell us about that process, that rollout that's going to be happening, and how the state plans to implement that? There have been talks about maybe setting up locations at schools when we talk to the governor, but we know that could also be somewhat problematic with parents not being there with their children during school hours. What can you tell us about just the overall rollout and that being made available for those children and parents that decide to get the vaccine?
So October 26th is the date that the FDA is going to meet and discuss the vaccination for kids 5 to 11. And then after the FDA makes a decision on it, if it's favorable, then it will go to the CDC for their review and for their decision for clinical use. And that would probably happen on November 2nd or 3rd. I think it's likely that it will be approved and that we will be seeing vaccination for kids 5 to 11, probably by early November. So, we've been planning for months for that eventuality as well. What we're really focused on is to make sure that vaccine is available and that it's easy for the kids to access. And so we're trying to do it through a number of ways. So we've been working with the pediatricians to be able to offer it in their offices, as well as in some of the clinics, pharmacies, with our healthcare partners and the healthcare systems that have been really instrumental in helping to get people vaccinated. And then also some of the pop-ups. We have been working very closely with the schools. And so we have solicited for any school that's interested, of the elementary schools, and we're trying to connect them with the healthcare providers so that they can do vaccination at the schools. This would obviously require the parents to consent, and would that be set up such that if the parents wanted to stay with the kids while they got vaccinated, that we could do that or not? We're still working on specific details, and some of it depends on the location, but we're just really trying to make it available, accessible. And again, this is all contingent upon the CDC giving the green light on this.
With the children, is it going to be the same kind of protocol? I know that the dosage is less, but will it be 2 shots spread a few weeks apart, or is it just a single shot for them? What do we know about that?
So we're still waiting for final word. My guess is that it will be also 2 shots of Pfizer spread 3 weeks apart. And you're exactly right. It's going to be 1/3 of the dose that adults received, and everything corresponding for the kids. So it'll be a tiny needle, and it'll be a much smaller dose, and really the key with the kids is to make sure that their safety. And I think that's why it's taken this long for the proposition to even come up to the FDA for review, is that really, really keyed in on safety for kids and what's the minimal dose that you can give them that will still give them immunity.
One of the key indicators that you, as well as the governor and other leaders, have been looking at is the hospitals and hospitalizations of COVID patients to help determine the lifting of restrictions and where we are as a community. What can you tell us right now about what we're seeing in the hospital, about those who are there, how many vaccinated, how many unvaccinated, and just any other general update of what you are hearing and seeing from our hospital systems?
The hospitals right now seem to be in really good shape and in a good position. As our cases come down, the number of people that end up sick enough that need to be in the hospital also, thankfully, is gone way down. So right now, I don't think it's an issue in terms of capacity, either for general med surg beds or for the ICU for COVID cases, and that's a good thing. By and large, the majority of the people in the hospital with COVID are those who are unvaccinated. I believe it's somewhere in the ballpark of like 15-ish percent, 18% of those who are hospitalized have been fully vaccinated. And statistically, as more people get vaccinated, that number should go up, right? Just as you have a more vaccinated population, the chance that anybody who's getting COVID is vaccinated will rise. But really, when we look at who's getting sick enough to need to be in the hospital, who's sick enough that they're in the ICU, those are unvaccinated people by and large.
Heidi's got a question here. We saw a headline about this. She says, can you also ask about vaccination and pregnancy? Sadly, we saw the third maternal death in Hawaii, a new mom that passed. We saw that reported in the paper. What can you tell us about vaccinations and pregnant women in Hawaii right now?
Yeah, that's just a very, very sad situation. Vaccines are safe. We know that they're safe even in pregnancy. And I think because pregnancy is considered a medical condition that puts you at high risk for severe COVID, if you should happen to get COVID when you're pregnant, we really, really would encourage those who are pregnant and those who are planning to become pregnant to please go and get vaccinated. It will protect you and it will help protect the baby.
Another community that we're watching right now is what's happening on the Big Island. We look at the numbers throughout the state, and what we're seeing on the Big Island is a higher positive percentage rate overall. What can you tell us about what's happening there with the other counties seeming to have numbers that are going in the right direction? The Big Island continues to have that positivity rate. I believe right now it's at about 3.6%. What can you tell us about what we're seeing there?
Well, we usually track the numbers by looking at the 7-day case average rather than each test result from day to day. Because as you know, there's variation in the case counts based on the day of the week, and that's tied somewhat to the amount of tests that were done. If you look at it for the state overall, for the past week, we've been pretty stable at about 114 new cases per day. It really hasn't gone down much. It's like Sunday through today, it's been 114, 115, 117, 119, 117, 115. So we're seeming to plateau right about there for the past week. And that looks like it's pretty steady for all of the counties. I think what you're referring to is the case count per 100,000 on the Big Island is a little bit higher. But I think it's been pretty stable, and the percent test positivity is under 5%. All of the counties are under 5%. So I think it's related to just what we're seeing now is just widespread community transmission of COVID.
With the numbers going down across the state, there have been calls for lifting of restrictions. The lieutenant governor was on this program earlier this week and said that he believes that all outdoor gatherings should be, allowed whatever size they want to be, as long as everyone is vaccinated. That could be an outdoor wedding, a luau, even the marathon. What are your thoughts on lifting restrictions? When do you expect us to see that? And are you comfortable with having large scale outdoor events if everyone is vaccinated?
I look forward to the time when we can all get back to doing what we used to do and socializing and whatnot. As noted, again, we're being very deliberate to make sure that our case count comes down and is nice and stable. In general, outdoor activities are pretty darn safe right now in our community. Please bear in mind that there are still over 400,000 people in our community that are not yet fully vaccinated. 400,000, that's a lot of people. That being said, we do have a lot of people that are fully vaccinated. So I don't think it'll ever be 100%. I think that's unrealistic. But I think it's safer outdoors than indoors. And in general, what we're trying to do now is open things outdoors and be very deliberate about it, be measured, open things outdoors, review it, see how we're doing, reevaluate our situation, and then keep opening, to more and more people, to larger gatherings, to more activities outdoors, and go from just seated activities to more interactive activities outdoors. I think that's very safe. Indoors, we're trying to do the same thing, but being a lot more cautious because we know that is much, much higher risk. And I think overall, when we look at reopening, the thought is, we know it's higher risk, right? So if we're indoors, if we're there for long periods of time, if we're not wearing our mask, if we're crowded close together, loud talking, yelling, singing, those are all high risk. And so to the extent that we can minimize activities that have more of those elements, then I think the activities will be safer. And so that's taken into consideration.
There are some who are calling for more testing to be done in order to go to some of these events, maybe requiring everyone to take a test regardless of vaccination status in order to get in, sort of a rapid test. What do you think the role of testing will play moving into the future as we see more people getting vaccinated, as we see these numbers continue to stay down? Do you think there will be this continued need and desire for people to want more frequent tests and tests in order to maybe attend some of these events?
So I think testing is kind of changing as the pandemic evolves. There are more and more tests now that we can do ourselves at home. There's more antigen testing. Testing should become cheaper. I think testing to get in, really what we want is if people are vaccinated, that will help the most. Obviously, we're not going to get that 100%, right? So how does it work if we test before we walk into an event or a gathering or something? Is that a safe thing to do? Is that reasonable? What's the cost involved? What's the availability of testing in order to do that? I think those are all questions that are going to need to be factored into whether or not we test before any certain event. And does that create a barrier for some people so that we would end up, making it more challenging for certain populations or certain sectors of the community or certain groups than others? Because we want to make sure that things that we do are equitable and are fair to people.
Cliff's got a question here, which is an interesting one about waning immunity. He says, if you got the 2 shots and don't take the booster shot, do they lose perks to go places like the unvaccinated? So this is asking, for instance, with Safe Access Oahu or on Maui, they have the Safer Outside program where there is vaccine verification required. At some point, should those programs, if they stay in place, require a booster because we know immunity does wane?
So what we know right now is that if you've had the 2 shots, it's still very protective against death, severe illness, and hospitalization. My understanding is that you are considered fully vaccinated in our state and as well on the national level if you've had the 2 doses of the mRNA vaccines or the single dose of the adenovirus, the Johnson & Johnson vaccine. That we're considering that fully vaccinated. We're not requiring you to get the booster before you're considered fully vaccinated. So you should still be okay. If you've got your 2 doses, you should be okay.
I wanted to give you a chance to respond to something that has been coming up in some of the reports and through some criticism of the department, of people saying that the Department of Health isn't releasing enough information and not providing and making that information accessible to the public. What are your responses to those who are criticizing the department about this and your thoughts overall about how the department has done during this time?
I think we've done a great job with the information and the data. Please go look at the Department of Health website and go to the Disease Outbreak and Control Division. There are screens that are interactive there for, travel, case counts, vaccination, death, race. There are so many different databases that you can access there where the numbers are out there. one of the things is that we want to make sure that the data we're releasing is accurate data. And so just because we get some numbers, we don't just immediately post things. We want to make sure that it's been, deduplicated and it's been verified and validated. But once we have that, we have been posting an awful lot of data on the website. So please go take a look there. There are so many different dashboards and screens that people can get into.
You did mention travel in that list of metrics that are out there. What are your thoughts on the governor opening up the state, if you will, rolling out the Welcome Act to visitors starting November 1st? Do you have any trepidation about the influx of visitors that are sure to come this holiday season?
None whatsoever. No, I'm kidding. So of course, from a public health standpoint, we're always watching and we're always cautious. I think it should be okay. I think especially that the governor is encouraging those who are fully vaccinated to come and visit us. That would be great. So please, if anybody wants to come visit us, get fully vaccinated before you come. For those that don't, they will still have the test options through the Safe Travel program. And my understanding is that Safe Travel program for domestic travel is going to stay in place at least for a bit more. And so that should help. But it's just, again, safeguards and just trying our best to keep our community safe. So making sure that we're doing the things that we as individuals know, wearing our mask and keeping our distance and whatnot. And so I think we should be okay.
And how long do you think the Safe Travels program should remain in place? At what point do you think that we'll be safe enough to lift that program, being the only state right now that currently requires that? Do you think that there may be a time, and when would that be, that time where we may not necessarily need this requirement for those coming in?
I think that's really going to be a wait and see, and it's dependent on the pandemic and on the virus. We're the only state that's an island state, so it's a little bit different because we have borders that, the Pacific Ocean, that people aren't just going to drive here from a neighboring state. We never expected Delta variant to hit us the way it did. That was a pretty good surprise across the United States and across the world. So I think it's really going to depend on how the pandemic goes. If we stay the way we are now, we should be in good condition. If another variant comes to our shores and wreaks havoc the way Delta did and is super transmissible, or worse, it causes, it's more virulent, again, that we'd have to deal with that. So it's really hard to say, at what point safe travels would go away. It is tied to the emergency proclamations, though. So
one of the other issues, of course, with traveling is Kama'aina going to visit folks on the mainland and bringing the virus back. We do know that there was significant community spread from that, not necessarily from tourists, but from people who go away to Vegas or to visit family and then come back and spread it in the community. The holidays are coming up. What's your advice to people right now? Is, so many people want to go see friends and family or just simply get out of town for a little bit. You've said before that it was not a good time to travel. What are your thoughts on travel right now?
Yeah, understandable that people want to go and visit relatives and, go take a break and go play and travel. Please, if you're going to travel, do it smartly and do it safely. We expect to see a rise after travel, exactly as that people go away, they engage in behavior, maybe not wearing their mask or, mingling with people who are not vaccinated, and then they tend to bring new variants back to our state. So if you're going to travel, please get vaccinated. Make sure you're fully vaccinated and make sure that those that you're going to be spending time with are fully vaccinated. So if that's your family on the mainland, please encourage them to be fully vaccinated. And that's going to make a much safer visit for everybody. Do things that are safe. Wear our masks, try and avoid long periods of time indoors without masks, because that's going to increase chances of people getting sick and of transmission. And we don't want people bringing COVID back home. We don't want people getting sick. I mean, short of ruining your vacation, you're going to get stuck on the mainland. You won't be able to come back home until you've cleared the infection. So please just make sure that you're doing things safely. Have a good time, spend time, stay in small groups.
The other question, of course, that many people have is about mask wearing and how long you think that people will be required to wear masks when going out, when socializing at these events. Of course, we know that you do not make these policies. This is not something that you determine yourself, but you ultimately provide consult to the governor and other elected officials about some of these restrictions. So what are your thoughts over on masks and how long you think we may be having to wear masks in some of these settings?
I think as we get more and more people vaccinated, and again, this is contingent upon not having a new variant sweep through town and really, kick us in the teeth. I think outdoors is much safer, and we should be able to do more and more activities outdoors and not worry so much about wearing masks. And especially as people are fully vaccinated, that should be pretty darn safe. And I think we are heading that way. Again, we're being cautious, and we're watching the science, and we're watching the data. Indoors, I think way back when the CDC said if you're vaccinated, you don't need to wear masks, we kept that in Hawaii. And then the Delta variant hit, and then CDC reversed and said, okay, we should be wearing masks indoors. So I think, we're being cautious, and we know that that's where the highest risk is for transmission. So I think we're going to see masks indoors for a little bit more, certainly longer than it's going to be required for outdoors. But again, we're watching, we're waiting, we're looking at what else is going on in the rest of the US and in the rest of the world. And I think that's one other point I'd like to make, is just that if there's really high disease transmission in other parts of the world, it will affect us. The variant, right now, the Delta variant, that came from another country, and then it hits us. So just because we are vaccinated and we have booster shots and whatnot, we still need to be cognizant of what's going on in the rest of the world, because as long as there's raging disease elsewhere, that is going to continue to affect us.
Well, we are almost out of time. I want to give you an opportunity for a final thought. We do know, as you mentioned, 400,000 in our community are still unvaccinated. Of course, that does include a lot of children, but there are still certainly quite a few adults in that population as well. So just some final thoughts this morning before we let you go.
I think just to reassure everybody, I think we are in a good place. The numbers are looking good. We as a community are doing well. The hospital side of things is doing well. We're trending in the right direction. Holidays are coming up. Please be safe. Wear your masks. Avoid large gatherings if you can. Go get your vaccine. That's number one. Go get vaccinated. And it's likely that we'll have vaccines for children in the not too distant future. Go get vaccine if you're eligible. That's going to help our community the most. That's going to get us out of this. That's going to get us back to where we want to be. And for those who are, for holiday travel and whatnot, we can open faster if people do what they're supposed to do, if they're behaving smartly, and our numbers stay low. So we're in a good place. Let's stay there. Go get vaccinated.
All right, Dr. Char, thank you so much for joining us here this morning and for taking our questions. We really appreciate having you on again. Thanks so much.
Thank you.
Aloha.
Thank you. Well, great to hear from her. And it was really interesting, when we were asking her about what level of virus we should feel comfortable with. There's no magic numbers, but she did say that if we can get our case count below triple digits, so, just anywhere below that would be a manageable situation. She did emphasize, of course, that no one wants to get COVID, and that about 30% of people who do get COVID still are experiencing symptoms 6 months later. So that is very significant. It's not like you just get it and it goes away. A significant percentage of people are dealing with this for long term, and we don't know what the lingering effects could be for years to come, which is why she's, of course, emphasizing vaccinations. But overall, she did sound cautiously optimistic.
Yeah, a lot more optimism than what we've heard in the past, and specifically in the past few months, of course, with Delta and the damage that it has had on our community. You heard a lot of things of what she's saying about restrictions, saying that she feels that it is time to start lifting those restrictions, but in a careful and measured approach, similar to what we've heard from the governor and his approach to reopening things regarding capacity sides and the way in which they plan on executing some of that. And also reiterating the fact that it is safer outside, and it is a point in time now where people can start thinking about travel, but also making sure that they are heeding to the discretion as well as the direction from health officials about how to travel, how to do it safely. And of course, that message of getting vaccinated continues to be one that they will continue to push moving forward.
Yeah, especially she emphasized pregnant women. We saw that third maternal death in Hawaii, which was so sad, reported in the paper yesterday. And also emphasizing that vaccinations for kids are coming in the probably in the next few weeks, and that could really be a game changer because we could see, tens of thousands of people in our community, some of that 400,000 that she talked about still not vaccinated, have access to the vaccine and get it. She did talk about school clinics, working with pediatricians, working with pop-up clinics, and even pharmacies to try to make it as widely available as possible. It does sound like it will be a 2-shot series, similar to what adults experience, but just in a much lower dose. So we look forward to hearing more on that in the coming days. Of course, one person that will be asking about that again, of course, is Governor David Ige, and he'll be here on Monday.
And there's no doubt, no short of topics that we have for the governor. Always a lot of questions, not only regarding COVID, but just some of the other things that are happening around the state. It's always great to hear from the governor. He will be here on Monday, and we're also going to be hearing from Hawaii Island Mayor Mitch Roth next week. We'll be talking to him on Wednesday to get an update of what's happening there on the Big Island with their COVID counts and some of the restrictions that were just lifted. So we look forward to those conversations next week. We thank you for being a part of this show, this COVID-19 show that feels like it keeps going on and on and on. But again, great to hear some optimism from Dr. Char and that we are heading in that right direction. So we thank you for being a part of this, and we'll see you right back here on Monday. Aloha.
Have a great weekend. Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.